morning. I'm going to ramble a little bit and we'll see how it turns out. If it turns out okay, then I'll post it. If not, I'll just blow it off or do it again. I am 56 years old, almost 57 here in a couple of months. My father died at 62. I think his father died at 62 or 50, 51 or somewhere. I can't remember. He died young. And then his father lived to be 98. That was my father's side. My mom's side, my grandfather lived to be 74, I believe. And my grandmother lived to be 90 something. 92 maybe, 90, I can't remember. My dad's mom lived to be 86, I think. I worked in hospice and with Alzheimer's patients, dementia patients, nursing home patients. I worked with the handicapped, the violent psychotic. I ran a group home as a manager. I worked in a group home before that. I've done a whole bunch of different jobs and trades, different careers. I'm certified in a lot of different things. I was a natural therapeutic specialist, a massage therapist, herbologist. I've done heating and air conditioning, propane delivery and installation, farming. I was a rescue firefighter. I worked for the Department of Defense. I was Air Force and soldier and an Army medic. I've done paper routes in restaurants and janitorial work, which is what I do now, janitorial work. It's a good retirement job. I've worked as a switchboard operator. I've worked back when they had the old plug-in kind of phone switchboards for a nursing home. I've done a lot of different jobs, okay, so that's really not the point. The point is I'm going to get at is healthcare system. So working in the healthcare system, and as I'm aging now myself and I'm starting to have physical problems, one of the things I've witnessed and now experienced multiple times with different doctors, because I was in the military and because I've done some different jobs, I've moved around so much, I've lived all over the place. And I've had a lot of different doctors. Some of them are good, some of them were lousy, really lousy. It seemed to me anyway. Nice people, but they just didn't seem to know what they were doing. I've experienced that as a healthcare provider. So I've had lots of patients that were neglected, despite people sticking up for them. The doctors and nurses trying to cover their own butts, worried about different things, not wanting to hassle with stuff, family members, whatever, the politics. The patients would get lost in all that and they wouldn't get taken care of and they would suffer a great deal. So I'm experiencing that myself to some degree, to a significant degree. Doctors are worried about getting sued. They're worried about getting, the hospitals are worried about getting tagged with violations and lawsuits. Forgive me, I'm going to stop and get some breakfast. I'm on my way to work. So, because they're worried about getting lawsuits, they tend to be very guarded on what they'll talk about, what they'll say, what they'll try to do to help you out. They don't want to color outside the lines. And unfortunately, every individual, well, fortunately and unfortunately, each individual is a different person. So we all have different systems. Hold on a second.
Can I help you?
Yeah, I'd like a sourdough breakfast sandwich and a medium hot.
Sourdough?
Yeah, sourdough breakfast sandwich and a medium hot chocolate.
Okay. Anything else?
That's it.
It's done for me.
Thank you. So what's going on with me? Well, I've got low testosterone. They don't know why. Several years ago, I got. It happened right at the same time I got a lot of mold exposure at work, and that's a whole nother can of worms to get into. But basically, I discovered that they had a lot of water leaks in the building, and they were seeping through the walls and getting into the carpeting, and basically it was a chronic mold problem, and from poor moisture control. I could go crazy talking about all that with my background, but I'm not going to. So basically, the same deal happened with my employers. They were worried about getting sued. They were worried about costs and cleanup, and I got caught between a rock and a hard place, and that's the same thing that's happened with the medical system. So what ended up happening was I got a severe infection, sinus infection from it, and my sinuses couldn't recover, and it was weakening my immune system, and so I had a bunch of mucus stuck in my sinus cavities that couldn't get out, and they had to go in and do surgery to open it up and make it drain, put tubes in. And of course, work wasn't going to accept any responsibility for that. They faked cleaning it up just to cover their butts, but they didn't have the money to do it, or whatever. For whatever reason, they didn't do it at the time. And then later, they moved me to a different building, but everybody else kept working there. And then later, when they did have the money, they did go ahead and remodel the building, redo it. I haven't been back there since to see if they actually fixed it or not, but the long story short is that right around that same time, my testosterone was discovered being low, and I couldn't bounce back, and so they put me on TRT. And I'm not sure if the mold was affecting my immune system and also affecting my endocrine system, because the sinuses are real close to the pituitary and the hypothalamus, and you know, I do have a lot of migraines since then. I still do. I just had one yesterday. So all that stuff could have something to do with it, but I don't know, and they never found out. The doctors never bothered to look. Well, so now fast forward 10 years later, and I'm having side effects from the testosterone replacement therapy, in that it sometimes makes it hard for me to sleep. But I don't think, after looking at, I went and got my medical records, and I don't think that's what the problem is. I think the problem is that metabolic syndrome. I may have damaged my kidneys and my liver. Certainly my digestion has been in trouble for a long time, and this again has to do with doctors. So when I was in high school, I'm sorry I'm rambling all over the place, but this is all connected and it's complex. And this is the problem with our medical system, is that they don't do complex. They do cookie cutter. So unless you're dying, and then they go complex. It's big business. So when I was a teenager, I had acne problems. So the doctors put me on I want to say erythromycin. I can't remember, but it was an antibiotic, and they left me on it for like 5 years or something. Okay, well then I joined the military, and I'm under a lot of stress, and I quit taking the antibiotics because I kind of grew out of it. But then I started having gut problems. I started having acid reflux. Probably a combination of what the antibiotics did to my gut and stress and poor diet, probably. And so then I got acid reflux and GERD, and they put me on.
Hi, 11:35.
Thank you. They put me on antacids and proton pump inhibitors. Thank you. Unfortunately, that lasted for almost 2 decades. I lost a bunch of teeth. I had all kinds of gut problems. And I don't know if you know this, but I learned the hard way that your gut is part of your brain. So, thank you. So what ended up happening was I started having anxiety and panic attacks. And it sure seemed like I was having heart attacks. But it was so difficult to tell the difference. Now, once you get a diagnosis like that, the doctors tend to start treating you like you're mental instead of treating you physical. They weren't putting it all together. They just weren't putting the pieces together at all. And they have a real bad habit of not, if you make a suggestion of what you think it might be, they don't want to accept that right away. And I understand that because they can throw them off. But when they've tried everything else and they're not finding the problem, they should probably listen to their patients a little bit more. So what ended up happening was I had GERD, and this went on for decades. I finally figured out that problem studying natural therapeutics, and I quit the proton pump inhibitors gradually and switched over to taking a tablespoon of apple cider vinegar with a glass of water once or twice a day with meals. And that cured my GERD. Simple solution. Basically, what it seems to have happened is that bad bacteria was slipping through because of my low stomach acid from the GERD. I probably had some yeast imbalance in my gut to begin with, too. All this was causing excessive gas. The excessive gas was pushing up on the sphincter of my stomach, esophagus, and it was causing it to open up with the low stomach acid, and I was getting acid reflux. Well, to fix that, I started taking probiotics, and I started taking apple cider vinegar, and the stomach acid went back up, the sphincter closed. That cured the GERD, but I still had the gut was out of whack, and it still is. I still struggle with that. It's gotten better, but it's still a struggle. And so, of course, that causes leaky gut, so I've got all kinds of skin issues and stuff. And I'm not so sure that I didn't do damage to my kidneys and my liver as well. I did have some, because of the high stress and poor stress management when I was a rescue firefighter and all the stuff that I went through on multiple levels. I drank too much at times. I kind of went through a spell where I was an alcoholic. I smoked weed, I smoked cigarettes, I chewed tobacco, I dabbled a little bit. I did some other harder drugs a little bit. I did a little bit of cocaine and meth a little bit when I was, not very much, just a couple of times. But I almost died one time on the cocaine. I swore I'd never ever do that again. My heart was racing and pounding out of my chest. And I haven't. Matter of fact, I quit all that stuff. I've cleaned my whole life up, and have for a long time. So that stuff should no longer be in my system, but it's very possible that it did permanent damage to some degree. Very possible. So I apply all the natural therapeutics I can, but it's, once your body's damaged to a certain degree, it's difficult and slow to recover, especially as you age and things start naturally falling apart a little bit anyway. So lately I've been having trouble with my kidneys. I get up to go to the bathroom all the time during the night. I don't sleep well, which just causes a snowball effect. You got to have sleep to heal. And the doctors aren't really paying attention They don't really recommend. They haven't recommended anything. My HDL's been low for a long time. I've had some blood work that's shown that my kidneys have been a little bit off. So all this points to liver and kidneys, and then the gut. It's all connected. All of it's connected. But the doctors aren't seeing it that way. They're not communicating it to me that way. They're not dealing with it in a holistic way. They're throwing drugs at symptoms. And it's extremely frustrating. And if you try to talk to them about it, they tend to get defensive. They've got egos in most cases. And they know more than you. Yet it's your body. And they're not listening to what you're telling them. So, that's why I end up having to do my own research. And I have to find my own solutions. But when you're sick and you're weak and you're tired and you're trying to take care of your kids and you're trying to go to work, that's an extremely difficult thing to do. So the moral of this whole rambling story that's all over the place is, I've learned a lot from experience of observation and working in the field and now experiencing it. You really need to educate yourself on the very basics of how your body works and how to keep it healthy and to live in moderation in all things, including moderation. Sometimes you need to go to extremes is what I'm saying. You need to exercise hard occasionally. You need to fast occasionally. You need to eat a little extra occasionally. But all of it needs to be in moderation. And your doctor is not in control of your body as much as they like to pretend they are. They don't have the final say on your body. They may have the final say on whether or not you get medications or care or good service or their time and efforts in trying to help you. That they do have control over. So you need to take that into consideration when you're talking to them. But from your perspective, or from my perspective as a patient, doctors are there as support, and they're there to help me figure out the solutions to my lifestyle that I need to implement to stay healthy or to get better or to die as peacefully as possible. Because sometimes there eventually comes a point where you cannot, without a miracle of God, you're not going to get better. So then it's all about, okay, how do I coast this plane in for a soft landing? And that was what my job was in hospice, to help other people do. It's a lot different when you're the one given the care than when you're the one that's going through all the struggles. So bear all these things in mind and get to know your family history and get to know your body and learn how to take care of it. Pay attention to the subtle things, because the subtle things are clues about bigger things that are coming. So, like I've pointed out, most of these problems I had were going on for decades. They went on for a long time. And the doctors weren't telling me, occasionally they make some recommendation, but it was inadequate for what needed to be done. Mostly they just gave medications and gave you common sense things. Get some rest, drink plenty of water, obvious things. But like the diet stuff is huge. How you feed your body's organs is very important. How you live your lifestyle is extremely important. And knowing your family genetics and your weaknesses can help you a great deal in preventing things from getting worse. So I've talked for 20 minutes now, and that's pretty much the max you can do on these videos. So I'm going to try to end it, but that's basically the moral to the story. I'm looking for a good doctor that will help me with these things and listen to me and work with me. So far, I haven't found one. The one I have now, I just switched to him, but right off the bat, when I started telling him and complaining about the problems I've been through, he's like, yeah, but then he changed the subject. Well, okay, that's an obvious indicator right off the bat. This guy is not interested in what my problems are. He's interested in dealing with whatever it is at the moment he's wanting to deal with to get on to the next patient. So, and that happens, okay? Even when I was a healthcare worker, I would have behavior clients that were like, okay, this guy's going to throw a fit, or this woman is going to throw a fit, and I don't have time for this. I've got 20 other patients to take care of. How can I get through this as quickly as possible? And at that moment, as a caregiver, my focus went from helping this person feel better to, I got bigger problems or more people to take care of than just this person, and so they're going to have to take some losses. And you don't want to become that as the patient. That's what I feel like I've become. So remember that all good comes from God, and He gives us the guidebook to live the healthiest lifestyle possible, and I have failed to do that multiple times. So a lot of this stuff, sin comes back to bite us. Yeah, I'm rambling at this point. I'm sorry. I'll just end it. But yeah, be careful what you do, how you do it. Do your research, and patiently find yourself a good doctor before you really need him. Because once you get to where I'm at, where I'm really needing some support, and I'm having a hard time finding it, and the whole medical system, all the doctors, the hospitals are all connected, and they're all connected with the insurance and pharmaceuticals, and it's big business. So yeah, good doctors, like good fathers, are few and far between. So find you a good one and educate yourself and live wisely. So with that, pray for me, a sinner. God bless. Over and out.